Local doctor is in for his everyday solutions. This week we talk with Dr. Z about depression and how to take care of mental health. The local doctor is in for everyday solutions. Dr. Z, depression, it's unfortunately so common nowadays. So talk about depression and how prevalent is it in Hawaii?
It's really common, and there's a lot of different stats. So there's one stat that says with anxiety or depression, we're up at 37%.
Yes.
I think the lowest estimates are at 12.7%, but there's a lot of depression out there. And especially coming out of COVID on one hand, all that isolation, all that uncertainty, the economic uncertainty, but then also all the screen time, people are more isolated at their screens, doing their social media, streaming, they're alone. And depression sets in so often.
Oh, so what can people do then to help with depression? Because as we know, and like you said, social media can lead to some depression. So what is your advice?
Well, I think that the most important thing first is to realize what some of the symptoms are.
Yes.
So it can be a feeling of loneliness, sadness, not having pleasure from normal activities,
sure,
hobbies, work. Sometimes for men, it can be more of a positive symptoms of depression, like agitation, anger, fighing, argument. But believe me, both genders, all genders are subject to that. Look, in general, depression can be prevented by staying socially connected, eating well, and moving the body, getting into the ocean. We saw some great surf here this morning.
Yes, and so what are the best lines of treatment for depression? That, we know possibly some of the reasons, but what can you do to treat depression?
Well, typically on a first-line basis, and these are for persistent symptoms, everyone feels down once in a while, everybody has a bad day, that's not depression. It's when it lasts for a while. And so sometimes we'll begin with talk therapy. We have a large psych department in the clinic, but talk therapy, and if necessary, medications. And these days, there's just really good medications to treat depression. Try a couple of those, and then we have some cases that are really resistant to treatment. And some of those are connected also to PTSD or traumatic brain injury, and it just doesn't get better with medication and therapy. And so now we're using a form of magnetic therapy where a little tapping a magnetic a device onto the brain that affects the emotional center, that is painless, drug-free, just done in the clinic. You can continue your schedule, and it's really effective in helping out with the tough cases.
Wow, I like that concept of just doing something non-medication, but this magnetic therapy.
Yeah.
So what if all these different therapies don't help someone with depression? What's your suggestion?
Well, I mean, the traditional thing is the most intense therapy is what's called this electroconvulsive therapy, but it's very intense, and I really have never prescribed it because it's just too intense. What we find, if we get good talk therapy going, modify the behavior, get the right medications on, and sometimes for the tough cases use this magnetic stimulation for the brain. It's very rare we don't get it taken care of.
Okay, mahalo, Dr. Z, appreciate it. And what can we expect for the following week?
Well, actually, I'll be going to Bhutan to meet with the Prime Minister there, who's a doctor, and they're opening a special administrative region in the southern part of the country. So I'll be meeting with him to see how that system should be set up. And we'll be talking a little bit about gross national happiness.
Whoa, looking forward to that. Mahalo, Dr. Z.